It's a problem that affects nearly 40% of men in this country over the age of 45, and many find it difficult to discuss. We're talking about male hypogonadism, or low testosterone. What causes it, the symptoms, and more importantly, an innovative treatment that's helping men feel better while avoiding some of the complications that can be a deal breaker for seeking treatment. Dr. Parviz Kavusi, a reproductive urologist, Austin Fertility and Reproductive Medicine, Westlake IVF, joins me virtually from Austin, Texas. Welcome to the show, Doctor.
Good morning, Olga. It's great to be here.
Doctor, let's talk about low testosterone in men. What causes it?
Low testosterone in men is very common, and it's primarily with aging in most men. There are other factors that can affect testosterone levels specifically in certain men, but for most men, we start losing testosterone at the age of 30, and we typically lose about 2% a year thereon, which means that it just kind of comes down to where do we peak during puberty or adolescence. If we don't peak very high, it may not take very long for that level to drop to a low level. So that's why we see so many men that are being diagnosed with low testosterone these days.
So what are some symptoms men should look out for?
Things like lower energy, fatiguing faster, lower libido, more difficulty with erectile function, more difficulty putting on and maintaining muscle, more difficulty burning fat mass, decreased exercise motivation, tolerance, and response, more difficulty with sleep, focus, and concentration. Some men will get hot flashes and night sweats when their levels are low, and more difficulty with moodiness and irritability. Other signs that we should be aware of are things like osteopenia, osteoporosis, a decrease in bone density over time, even fractures at younger ages than expected, or things like having more difficulty regulating blood sugars are all indicators that we should raise our eyebrow about, is a low testosterone a potential contributor?
It's more than just a low sex drive, right? It can really affect a man's overall health and impact his life dramatically.
The problem is low testosterone is being underdiagnosed and undertreated. In the United States right now, it's estimated that 13.1 million men should be diagnosed with low testosterone every year as a new diagnosis, and we believe that around 5% of these men are actually getting treated. There's a large undertreatment in the percentage of men that should be treated.
Doctor, to put this in perspective, we recently talked with one of your patients who suffers from low testosterone and his fiancée. Let's take a look.
In my 30s, I noticed just a marked decrease in my endurance levels, my general sense of vitality, and mood swings, irritability where I hadn't noticed before. Things that really weren't an issue in the past all of a sudden started becoming much more difficult for me to do, loss of libido, and just feeling lethargic in general. I just noticed a gradual loss of interest, and it just was concerning to me. I thought, well, I'm not old enough to have my sex life go away, and so I wanted to find out what was going on.
I could see that he was struggling. I could see that he was trying to get answers. I could see that he was working toward a solution instead of just accepting his fate.
You know, once I found out from the doctor that my testosterone levels were pretty low, then that was a relief to at least feel like I had an answer to all of these different things that were suddenly bothering me.
When a patient is diagnosed with low testosterone, what is normally prescribed? What is traditional standard of care?
When they've told us which route they want to go, if they want to maintain fertility potential or not, their treatment goes in that direction. In men that have traditionally wanted to be able to have kids in the future, there are medications we can use to stimulate testosterone production, but most men don't get as strong of a symptom response. They don't feel as well on those as they do to direct testosterone replacement. If men are no longer interested in fertility, we turn towards testosterone replacement with either things classically like intramuscular injections or topical gels, but they have potential challenges.
I want to talk about another treatment option for low T. It's called Natesto. I have a sample right here. Doctor, what is it and how does this work?
Natesto is a very unique formulation of testosterone replacement that is the only intranasal formulation for testosterone replacement. It's a nasal gel. It gets injected into the nostrils, and there's a lot of really nice features to this. It's easy to use. It's easy to travel if it comes in a small applicator container. It's non-invasive, and it works in 90% of men at getting their testosterone levels up. And there's data that shows that within 30 days of initiation of treatment, men are getting significant symptomatic improvement. The things that are really interesting about this product are that it maintains physiology. So our natural testosterone is pulsatile, and Natesto matches that. So unlike any other testosterone product, it's not suppressing the testicles and their ability to do their jobs. So when we give Natesto, it's given in a physiologic manner. The testicles keep working, and we're giving testosterone on top of that. It also can help maintain lower estrogen levels, so we minimize the risk of breast tissue deposition. It minimizes hormones that cause hair loss, and the risk of red blood cell thickening on this drug is extremely low compared to other treatment options. So all the things that we don't like about testosterone replacement as side effects, we really get rid of with this drug.
So, doctor, why would a patient take a short-acting treatment like this one instead of traditional options?
Natesto also does not have a box warning for any risks like blood pressure. It has a very favorable side effect profile that's very low risk, and our patients love it. We get such great feedback from them on it. So it is a very tolerable, very effective treatment for low testosterone that has very minimal risks that go along with it.
Doctor, I want to go back to your patient, Corey. He's been using Natesto for about a year. Let's see how he's doing.
When I started using Natesto, within the first few days, I noticed a big difference in my mental clarity was something that I noticed immediately. And then energy started to pick up, and I noticed an increase in my libido. And those three things combined, I just thought, this is fantastic. This is really going to make a difference.
He had more energy, he had hope. He was telling me kind of repeatedly, like, I think this is working.
The fact that I noticed an immediate increase in my libido was amazing to me, because then I was able to express to her physically the way that I felt emotionally. Life is a lot better. It's a lot brighter. I'm very grateful to have an amazing partner who has been there for me, and extent of that is us getting married, and really looking forward to that, and us starting a family.
It's so great to see him so happy. Doctor, final thoughts?
So Corey's a perfect example of what we see day in, day out. Men that were low that got treated to normalized levels and are really getting that improvement in their quality of life. They're getting their life back, essentially. And Natesto is a really important drug in this category to consider because it's more natural, because it allows the body to keep working and do all the good things it does without some of the risks that we can see with other potential treatments. So it's really important for men that have these symptoms to come forward and ask to be tested and get treated appropriately and try to get that quality of life back themselves. And really, that's the part of our job that's so rewarding when we see these responses like we see for Corey.
Great information. I want to thank Corey and his fiancée for their story. We wish them well. And doctor, thank you so much for your time and all the information.
Thanks so much for having me.
By the way, for more information, you can go to natesto.com or just check out our website, thebalancingAct.com. We'll be right back.